Thank you for watching Weekend Prime and welcome back. We'll continue updating you now. Currently, there are no licensed therapeutics or vaccines specifically approved for prevention and treatment of the Bundibugyo species of the Ebola virus. However, while the current outbreak continues to wreak havoc in the Democratic Republic of Congo and the neighboring Uganda, the recovery of at least 8 people that had contracted the rare type of Ebola now signals hope in one of the most dangerous public health emergencies. On this episode of Health Digest, Gloria Milimo interrogates what recovering from a viral hemorrhagic fever like Ebola virus means and why these recoveries are crucial in the fight against the current and future outbreaks. Take a look.
In what is described as a rare but powerful sign of hope amid an epidemic that public health experts describe as the third largest outbreak since Ebola was discovered half a century ago, the World Health Organization confirmed the first major patient recoveries in the wake of the ongoing Ebola outbreak in the Democratic Republic of Congo. The recovery of at least 6 people in DRC and 2 others in Uganda, marking an important development in the war against a virus whose rare species currently has no approved vaccine or antiviral, leaving patients at the mercy of supportive care. The World Health Organization said that the recoveries are a demonstration that the virus can be stopped. Through its Director General Dr. Tedros Adhanom Ghebreyesus, WHO emphasized the role of timely care in surviving the Bundibugyo virus. He argues that the recoveries demonstrate the life-saving potential of early diagnosis and medical intervention.
People can survive Ebola if they have access to care and go to health facilities as soon as they show symptoms. But we still face several challenges. First, testing.
What we call fatality rate varies from 30 to 90%, meaning that if Ebola virus infects 10 people, you expect between 3 to 9 out of the 10 to die out of Ebola.
Professor Julius Oyugi, a virologist, says that recovery from a viral hemorrhagic fever virus like Ebola is often a race between the virus and the immune system.
There are people who have a stronger ability to fight diseases because of their genetics compared to others. There are also other factors like maybe age.
When a patient eventually recovers, he explains that they develop immunity. This immunity develops when the body sort of learns the virus, and that memory helps in protecting against getting infected by the same disease again.
They develop natural immunity, meaning that if they ever get exposed to Ebola again in future, they may not get infected with Ebola. And this immunity lasts for many years. Some says from 10 to 40 years.
Despite this, he warns that traces of the virus can still linger in some organs of the body even after recovery, especially in men. These organs include the eyes, the brain, and the testicles.
Out of these people who recover, actually all of them, particularly in men, the virus still persists in organs which cannot be reached by the immunity. And these organs include the testicles for men, meaning that the virus can be found in sperms of those who have recovered from Ebola for up to 1 year.
In this case, for the recovered male patients, he advises against engaging in unprotected sexual intercourse for at least 1 year.
Out of 10 people who recovered from Ebola, these are men, about 3 of them still have sperms in their virus in their sperms, and by the 12th month, the virus only about 6 to 10% have traces of the virus in the sperm.
Hemorrhagic viruses like Ebola often damages blood vessels, causing them to leak. And this, according to Professor Oyugi, happens during the second stage of infection. Recovery from the disease means that the body has been able to clear the virus and been able to survive the critical phase of organ damage and bleeding. The disease often strains major organs like the lungs and kidneys.
When the virus gets into your body, it gets into the blood, and then it starts multiplying, making new copies of itself in large numbers. And the virus is carried to almost all organs of your body through blood. But what it does, why you end up bleeding, is that the blood vessels, where your blood normally flows, it makes the blood vessels to be permeable. Permeable means it allows blood to zip out of the blood vessels to the outside. That is why people who are infected with this hemorrhagic fever viruses bleed.
But even as the world enters one of the critical phases of the outbreak, the success of the ongoing experimental antiviral and immune-based therapies is said to be critical in enhancing treatment outcomes for patients. Similarly, scientists also say that a vaccine against the Bundibujo virus is on the horizon, and that the ongoing research involving at least 3 different vaccine candidates will help fight the virus in a more comprehensive and sustainable manner. So far, the rapidly escalating outbreak has left at least 344 people infected and 60 others dead across the provinces of Ituri, North Kivu, and South Kivu. WHO also says the number of suspected cases in the epicenter of the outbreak has also plunged to 116 from the over 1,000 previously suspected cases. Meanwhile, in the neighboring Uganda, at least 1 person has died from Ebola, as 15 others remain infected. Gloria Milimu, KTN.